Welcome to Congressman Brindisi's August Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this evening. Thank you for joining us for an informative discussion with the Congressman and tonight's panel of guests with question and answer session between the audience and the panel at the end. In addition to hearing from the Congressman this evening, we've got a local doctor and a representative from the IRS on the line to answer your questions. We're going to be starting the call shortly, but we'll let folks continue to dial in for a few more minutes. If you've got a question that you'd like to ask during the question and answer session, please press *3 to join the queue. For folks just joining us, welcome to Congressman Brindisi's August Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this evening. In addition to hearing from the Congressman, we've got a local doctor and a representative from the IRS on the line to answer your questions. In order to ask a question during the question and answer session at the end, all you have to do is press *3, that's *3 to ask a question. And we do anticipate receiving a lot of questions this evening, and we're going to do our best to get through as many of them as possible. But if you don't get the chance to ask your question, please hold on the line at the end to leave us a message so we can get back to you. We'll get started in just a bit, but just wanted to remind everyone that the way to ask a question is to press *3. For folks just joining us, welcome to Congressman Brindisi's August Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this evening. In order to ask a question, just press *3. And I think we'll get started. So without further ado, I'll turn it over to Congressman Anthony Brindisi. Anthony?
Well, thank you, Sarah, and thank you to our guests and for everyone who's joining the call today and taking time out of your busy evenings to join me. As we continue to fight back against the global pandemic and do our best to safely and responsibly reopen our upstate economy, it's more important than ever that we hold events like this. Since COVID-19 first came to our shores, I've held numerous telephone town hall meetings, Zoom meetings, and conference calls with local workers, families, small businesses, and government officials. This dark time in our nation's history has highlighted the remarkable spirit, tenacity, and friendship of people in our region. We've worked hard to flatten the curve, and numbers across our region have allowed us to responsibly restart our economy. But families, businesses, and communities continue to struggle, and unfortunately, Washington needs to be more helpful. I am disgusted by the petty partisan politics going on in Washington while our local communities continue to struggle. It's time for Washington to cut the party politics and put our country first. As negotiations on the next COVID-19 relief package continue, I'm ready and at the table with my friends from both sides of the aisle to get things done. We need more money for testing, more money to help our small businesses and farms, aid for displaced and unemployed workers, and critical funding for small towns, local governments, and school districts. Big cities like New York City and states with fewer COVID cases like South Dakota got their funds. But communities like Cortland or Rome, Cazenovia or Pulaski have budgets and school districts that are in dire straits. Our essential workers, people like our teachers, our sanitation workers, our doctors, nurses, bus drivers, stood up and helped us during this time of need. We can't let their efforts be forgotten and can't see our school districts, hospitals, or local governments crumble after they held us up. That's why I'm fighting each and every day during these negotiations to deliver crucial aid for hospitals, small businesses, and state and local governments. If you're just joining us, this is Anthony Brindisi, and I'm hosting my August telephone town hall. With the ongoing pandemic, my office is here to serve you. I will be taking questions in a moment, but I wanted to let Sarah take a brief moment and introduce our guests for the evening. Sarah, back to you.
Thanks, Anthony. So our first panelist is Dr. Catherine Katie Anderson, Director of SUNY Upstate Medical University's Center for International Research. Dr. Anderson?
Hi, good evening. Thank you so much for the opportunity to be here this evening. So as Sarah mentioned, I'm an internal medicine physician at SUNY Upstate Medical University and a practicing infectious disease epidemiologist. And I've spent over 20 years researching the patterns of spread and disease associated with various viruses, but in the past few months, most intensely COVID-19 in our area. And as a community and as scientists and also as medical practitioners, in the last 4 months, we have learned a lot about COVID in upstate New York. Having observed what happened in New York City with the catastrophic epidemic that they had, we sprang into action early and we imposed social distancing and mask wearing in March. And thankfully, we as a community demonstrated, and we continue to demonstrate, that these very simple measures work and that they're powerful. And this is really critical because one thing I like to emphasize is that the virus hasn't changed. It's just as contagious, just as serious as it was when it first arrived here. And we as a population have not changed. So if we look at the blood of people in our area and look for antibodies or signs that people were exposed to the virus, it may still be as low as maybe 2%, 2 to 5% of us that have been exposed to date. So we are largely sitting as vulnerable as we were when this first began. So as thankfully our children begin to go back to school, our neighbors begin to go back to work, it's critical that we don't let down our guard. We need to continue our adherence to mask wearing, to distancing, and hand washing. And it's really clear, it's simple, and it's really serious. But I also want to reinforce, because this has been a really hard 4 months, that this is really good news that these measures work. When the virus first appeared here in March, we really had no idea as a public health community, as clinicians, if we would be able to slow the spread and what was awaiting us. The good news this long 4 months later is that we have shown that we can slow the spread. We know what to do and we just need to keep doing it. So thanks again for having me, and I look forward to your questions.
Thank you so much. Our other panelist joining the Congressman this evening is Annabelle Marquez, the District Congressional Liaison for the IRS. Ms. Marquez?
Good evening. Thank you very much for inviting me to this meeting, Congressman Brindisi. Like you said, my name is Annabelle Marquez. I'm an IRS Congressional Liaison. And well, my office works with congressional districts to help constituents with IRS and tax-related questions. Today, I'm happy to share IRS information. I'll start by sharing that the IRS is focused on implementing the COVID relief legislation and providing as much help as we can, as soon as we can, for taxpayers. On March 27, 2020, the President signed the Coronavirus Aid, Relief, and Economic Security Act, the CARES Act, into law. This authorized financial relief in the form of economic impact payments, also known as EIPs. Within 2 weeks of the enactment of the CARES Act, the IRS and our partners at the Bureau of the Fiscal Service distributed EIPs totaling more than $147 billion to more than 81 million people. We base these payments on information taxpayers reported on 2018 and 2019 tax returns. Our IRS employees have worked around the clock to successfully launch and deliver these EIPs, which have now reached over 159 million taxpayers nationwide. The IRS and others acted with unprecedented speed, even as COVID-19 personally affected employees. We created non-filer and Get My Payment tools on irs.gov. These were designed to help people obtain their EIPs. We also conducted extensive outreach to ensure EIP information sharing. We distributed information to national, state, and local communities, general and tax-related media, state and local tax authorities, and others. We reached beyond our normal contacts to distribute these payments to many lower-income, non-filer, military, veteran, and homeless communities. These vulnerable groups of people might otherwise not provide information that would enable us to generate the payments on their behalf. For example, we've begun initiatives to help homeless Americans who become aware of their EIP eligibility. In addition to creating the non-filer and Get My Payment tools, the IRS took the unprecedented step of issuing automatic payments based solely on information detailing individuals who receive monthly benefits from other government agencies. For example, the Social Security Administration, Department of Veteran Affairs, and Railroad Retirement Board, and who are eligible for an EIP. These automatic payments require the development of new processes and computer programming to allow the agency to receive needed information about these individuals, determine the advanced credit amount, and issue their EIPs. As you imagine, undertaking implementation of this complex legislation during the already busy 2020 filing season was very resource intensive. As an agency, we rescaled IRS operations due to the closure of more than 90% of our buildings, but we successfully maintained required core operations with over 47,000 employees teleworking and others remaining in various facilities. As of June 19th, the IRS has processed almost 127 million returns and issued more than 93 million tax refunds. Processing had begun for tax returns received in late February. When we stopped processing them, we stopped processing them when we closed all 4 of our submission processing centers. This closure affected the processing of paper returns and electronically filed returns that contain errors or that require intervention. Now we're in the process of resuming operations by recalling some employees in compliance with the Centers for Disease Control social distancing guidelines, and so operations have resumed. I will mention that we've opened the toll-free lines for taxpayers and tax professionals, including the IRS toll-free EIP phone line. That number is 1-800-919-9835. However, staffing still remains limited. Also, the IRS website, irs.gov, is a great resource for all things IRS and economic impact payments. Our coronavirus information page is frequently updated, providing the latest developments on EIPs. Now, as the IRS has resumed many of its operations, in returning to our offices, IRS employees are processing millions of backlogged cases and documents. So the IRS continues to prioritize employee safety, but as you can imagine, many taxpayers waiting for their paper filed returns to be processed may have to wait extra time. The IRS will continue to implement, follow, and wherever possible exceed specific federal safety lines and measures, including social distancing at all facilities. We understand there are many taxpayers who have yet to receive their tax refunds and their economic impact payments. As a reminder, based on the CARES Act legislation, EIPs will be available through December 31st. Please know that we are working hard to ensure everyone eligible for an EIP gets their money as soon as possible. Thank you.
All right, thank you so much. Just a reminder for anyone who's joined the call, if you've got a question, the way to ask it is to press *3. So let's go to our first question. We've got Lewis from Utica. Lewis, can you hear us?
Yes.
All right, you've got a question?
Well, I have a couple questions. All right. Now, the first one is on the minds of probably millions of Americans across this great country. What is the major holdup? Why are the Senate leaders and the Congress, or the House, acting like the money's coming out of their pockets? My second question is, how close is anyone to creating a cure or a preventative medicine so that we might be able to get back on a normal routine?
Thank you, Louis. I can take maybe the first part of that question regarding the next stimulus measure, and then maybe Dr. Anderson, if you want to weigh in on the latest in terms of a cure or some preventative treatment for the virus. So regarding the stimulus, so far the House, the Senate has passed several bipartisan economic stimulus packages, both to fight the public health crisis as well as the economic fallout that's happening as a result of coronavirus. As many of you may know, the House did pass back in May another stimulus package. Unfortunately, the Senate has failed to act up until this past month and has finally decided that it's time to move forward on a stimulus package. There are a number of sticking points, and what we need now is more bipartisan compromise to be able to get things done, because we're clearly not out of the woods yet. In terms of the virus, we're seeing large spikes in the virus across the country. Testing in many states around the country is certainly not kept up to where it needs to be, and people are waiting far too long to get the results of their test, which is not helpful when trying to combat this virus. So we need more funding for testing, and we need more funding for the economic impacts of this, because many small businesses continue to struggle. Many school districts are expected to at least perhaps partially reopen come next month, and need help to be able to do that at a time when state budgets are cutting education funding. So I'm working very hard right now to try and bring together people on both sides of the aisle to pass a new stimulus package that helps people who are still out of work, that provides more aid for small businesses and farmers, that helps state and local governments. My big worry going forward here, and one of the big reasons why I supported the House measure back in May, was to get aid to our state and localities, because many large areas around the country, populations of over 500,000 people, did receive aid in the CARES Act. Unfortunately, that doesn't impact many of the communities, or any of the communities across our congressional district. So counties are struggling with declining revenues. School districts are seeing aid to education cut. Healthcare is seeing a cut in funding from the state. And if we don't get help from the federal government to make up some of those losses, then hospitals are going to be forced to cut back on staffing. School districts are going to be forced to cut back on teachers and support staff. Many of our local governments are going to have to cut back on public safety and infrastructure projects, which is going to lead to more job loss across our region. So I don't think aid should be going towards items unrelated to coronavirus. It should be targeted to help replace revenue that's been lost as a result of the pandemic, or to cover expenses related to the pandemic. But we have to get that aid in the next package here to be able to continue to fight back against coronavirus. And all the experts agree that more needs to be done. Doctor, I don't know if you want to talk a little bit about potential cures or where we're at with vaccines.
Yeah. So that's the million-dollar question, is when will this all be over? And what will the new normal look like? So bottom line up front, that our experience with COVID will end when enough of us have been exposed to it or are vaccinated that it stops the spread. Generally, if we don't have a vaccine, that could take a year or two. As we all know from the media, there are many, many vaccines that are in development. They're all moving along at a pace that is much faster than anything we've done before. There are some that are showing some early promise, but the way that we develop vaccines is real slow and stepwise for a reason, that we want to go forward and vaccinate, large portions of our population with something that we know will be safe and that we're pretty sure will work. So that said, there's at least 3 candidates, and 2 of them that are being developed in the United States, that are showing that they at least are safe and may have a good immune response. So just looking at blood, they look like they might protect you, but the next step is to vaccinate huge numbers of people and show that it really does protect you, and that takes some time. There's been some discussion in the media that we may be able to have information like that by the end of the year, but for me, speaking as someone who works in public health and vaccines, that seems ambitious, but I would be happy to be surprised. Then once we have a vaccine that works, we have to manufacture it, we have to distribute it, we have to message it to people and have them agree to take it. And all of that, particularly the manufacturing, could take some time as well. So for me personally, and again, I'm prepared and hoping that I'm surprised and that I'm being overly pessimistic, I think about the future being the next 1 to 2 years will be us wearing masks, social distancing, hopefully continuing to open things, but in a very smart way, and living a new normal that is us living with COVID and trying to slow the spread until we have a vaccine that works. I'll also mention other preventive measures, so medications. That currently we have less reason to be optimistic about. There are a few drugs. You may have heard people talk about remdesivir or dexamethasone. The latter, dexamethasone, is just simply steroids. Those have been shown to work for people who are very seriously ill, which thankfully for COVID is the minority of people. Most people do pretty well with COVID. But for people who are very seriously ill, like in the ICU or requiring oxygen, those drugs show some success. But in terms of slowing the spread, it wouldn't help with that. The horse is kind of out of the barn already when people are in the ICU and so ill. So again, I don't want people to feel disheartened, although it's understandable if they do at this point in the epidemic, that this is going to be with us, I believe, well into the foreseeable future, at least a year, maybe 2 years. But we have shown that we can slow the spread and that we can smartly open up some parts of our economy and our schools if we do it in a smart way.
I will just add on to that too, Doctor, that in the CARES Act that we did pass earlier this year, which was signed into law, there was $27 billion included for vaccine development and funding for vaccine trials that many of the drug companies are now running. I would say regarding a COVID vaccine, we have to ensure that the FDA completes strict oversight and clinical trials to ensure it's safe. There's a lot of misinformation going around out there on Facebook and on other social media companies. So we have to make sure that we do our homework and we listen to the public health experts.
Thank you.
All right, great. Thank you guys so much. Moving on to another caller, we've got a question from Joe in Bethel. Joe, can you hear us?
Yes, I can. Thank you. Congressman, yes, I do. Congressman, recently President Obama spoke rather bluntly in regards to the Postal Service being attacked by the current administration. Postal workers, the letter carriers, the others involved, these are all essential workers. They say that mail volume, I say they, the American Postal Workers Union recently published that mail volume was down significantly, and as a result, the status of the Postal Service as a viable function is becoming economically affected by COVID. Is there anything ongoing in the Congress that you're aware of to prop up this necessary American function? The U.S. Postal Service is our backbone of communication.
Well, Joe, thank you for that question, and I agree with you. They are the backbone of our communication here in this country, as old as the Constitution. And I really am saddened to see what is happening with our Postal Service because of folks in Washington who really want to, privatize it or use it to settle scores, which is unfortunate. I will say that I've been working very hard and listening to our postal workers and our letter carriers about what kind of support they need right now going into the fall and to continue to stay solvent. The HEROES Act that we did pass in the House of Representatives back in May did provide $25 billion for the United States Postal Service, and it's something that we are pushing for, and I'm pushing for, as we move forward into negotiations right now in the next stimulus package. We have got to have a strong Postal Service, and it matters so much, especially in districts like ours, where you have many small towns and rural areas. When there are cutbacks at the Postal Service, it's going to affect those areas first, and we don't want to see that happen. There is a bipartisan commission that the President appoints for the Postal Service, which has asked for funding to help keep the Postal Service going. I'm not very happy with the new Postmaster General that's been appointed. I feel that there is an attempt to try and privatize the Postal Service or really weaken it to the benefit of their competitors, and we can't let that happen. We need to have a strong Postal Service in this country. It's something that has traditionally enjoyed bipartisan support, and I'll continue to fight for our postal workers and our letter carriers and make sure that we have a strong postal service for our community.
Thank you so much. We've got another caller. We've got Jacob from Whitesboro. Jacob, can you hear us?
Yes, I can. How are you?
I'm doing well. You've got a question?
Yes, actually, I have a couple questions here in regards to this whole quarantine thing and how it's going over. Unfortunately, my wife came back positive for COVID, and my father-in-law came back positive back last month for COVID. So my family, we've been exposed to this thing twice. We've been quarantined twice. The first time around, I was pretty upset because, we didn't wind up getting it, but my mother-in-law was never tested, and they did quarantine them for 2 weeks. But the whole thing about it is basically they sent her back to work, and at that point in time, she could have been positive because when you're, so to say, low symptom or asymptomatic, I guess he did have some symptoms, but not very much. She could have caught it at any given time during that time. This time around, my wife has had pretty rough symptoms. She was tested on the 20th of last month, came back positive. She works in the health field. And me personally, I tested on the 24th, came back negative. They extended my quarantine date longer than the 14 days, but they didn't extend my wife's. They're expecting her to go back to work on Tuesday if the test comes back, negative for her, but they've extended my quarantine out further. So in response, we decided to get an actual further testing. So we had contacted the coronavirus hotline and got retested again on Saturday, both of us. So if them both come back negative, then, I'm definitely not going to be interested in let them extend this even further. But I think what they're doing is they're hitting, in some cases, they're not doing enough. They're underkilling things, and in other cases, they're overkilling them. And I don't think they found a happy medium. They either do, nothing, or they do an extremism type situation. And that seems like that's a common thing in today's politics along with this virus. I don't know what is the actual protocol for this and where does this all stand. And then one other thing I wanted to throw out there too, I've actually been trying to reach out for this question as well, is I live in Whitesboro and we suffered a massive flood in Halloween night of last year. And I'm looking to see where the standpoint on dealing with that situation is, because if we got flooded again, we'd all get put into an area which coronavirus could be dramatically a nasty thing for us in that standpoint, because it would spread rapidly and there's really no other place to put us but in the fire department. So them are a couple different questions. I don't know what you can do.
Well, Jacob, I can touch upon some of the flooding issues, and then, Doctor, maybe if you could speak on just testing protocol and what the testing protocol is right now, and any other thoughts you have around that. And Jacob, I'm very sorry for what you and your wife are going through. I know it's not easy to contract this virus, and my thoughts and prayers are with you guys, and I hope everyone has a safe and speedy recovery. Regarding flooding, Whitesboro, as you know, Jacob, and I've known this through my time in the state assembly and before, is certainly no stranger to flooding. The Halloween floods were devastating last year, and I was very disappointed that FEMA denied us the individual assistance to help homeowners, but they did provide the public assistance, which I know many of the municipalities are working through right now. I know that we are working still very closely with the local officials there in Whitesboro and the Sequoia Creek Commission regarding resiliency projects and what needs to be done to prevent this kind of flooding from happening or mitigate future damage from happening. And we can definitely follow up with you. I'd love to connect you with Mark in my office, in my Utica office, who's handling all the flooding issues, to give you a better update as to where things stand. But you're right. As we're seeing down in Florida and other areas right now because of the hurricanes, natural disasters during coronavirus are not ideal. especially if folks have to be evacuated and put into emergency shelters. So that's another reason why we have to defeat this virus as soon as possible, because there are other enemies out there that are certainly certainly going to affect our ability to be able to stay healthy. But we can connect you with, we'll get your contact information and connect you with Mark on the flooding issues. And Doctor, if you want to just talk generally about some of the testing protocols.
Yeah, sure. So Jacob, yeah, I share the regrets that your family is enduring so much during this pandemic. Unfortunately, that tends to be what we've seen a lot, that certain families get hit harder than others, and particularly those who are frontline health workers and other folks who are more likely to be exposed. So I'll say out front, I don't work for the county or any county. I don't represent them, and I'm not in their shoes. So I can't speak, with great authority on their specific policies and procedures, and they vary county to county, and they also vary over time, which has made all of this complex and a little bit confusing as we all kind of catch up to this virus in the setting of limited resources. We don't have enough tests, we don't have enough people, and as Governor Cuomo has said, we've been a couple steps behind in understanding this virus ever since it first came out. So with all of those challenges laid out, I can see why some of the information and the messaging is confusing to people and sometimes even contradictory. But one thing I will say, I do some outreach with the community here in Onondaga County, and I've heard that same scenario a couple of times where unfortunately someone in a household has gotten sick, they have COVID, they're tested and positive, and they have symptoms. So the county will track their symptoms, and then when their symptoms are gone for a certain number of days, at least here in Onondaga County, they can be cleared and go back to work. Often that will happen sooner than 2 weeks, and it's confusing and frustrating, which I can relate to, for the people who are in the home who don't have any symptoms and in fact are negative, but they have to quarantine for at least 2 weeks, and sometimes the county will extend, as is their purview. And the rationale for that is that we believe presently that most people will have symptoms about 5 days, if they're going to have symptoms about 5 days after they are exposed, but it may take out to 2 weeks. And so just because you don't have symptoms a week later, just because you test negative a week later, doesn't mean that you'd actually be negative. So that's why these family members end up being in that, I understand, frustrating position of saying, hey, the person who tested positive in my family is feeling better and they're going back to work, but we're all still sitting around for 2 weeks. That's the biological reason for it, but I can certainly understand the frustration. That's all I have to say on that.
Thank you so much. All right, let's take another question. We've got Sue in Little Falls. Sue, can you hear us?
Yes, I can.
All right, you've got a question?
Yes, I was calling on the status of rural broadband. In 2017, Governor Cuomo had stated by the end of 2018 that rural broadband would be accessible to residents in New York State. And I've been in contact with New York State Broadband Program following the status of shovel-ready projects, so to speak, and also certain counties that do have this service available to them. But I have been in contact with them every 2 weeks within the past year to only receive canned emails back saying, as soon as it is available, we will notify you. I do have to give a kudos to your office because actually you're the only office that has gotten back to me. I was in contact with Jason Phillips, Deputy District Director in your office, and he was very, very helpful. But I was just wondering, Verizon, according to the broadband program, stated that they had received $750,000 grant, which would encompass the area of the town of Manheim that I currently live in. But I can't receive any answer from Verizon or from New York State Broadband when this service would be available to the residents.
Well, Sue, thank you for your question. This is a very timely question. I just actually had a rural broadband forum this morning with one of the FCC commissioners, Jessica Rosenworcel, who's one of the 5 FCC commissioners. And really what started this whole meeting was a meeting that I had with her last year where we talked about many folks not getting broadband throughout the region and the poor mapping system that FCC has to really determine where the gaps in coverage are. So the commissioner encouraged me to conduct a survey here in the district of where the gaps in coverage are, and we released the results of that survey today. And what we really found was a number of takeaways. One is that the FCC has to do a better job of collecting their data and targeting their investments where they are fully needed. We need to also invest more in broadband in rural areas, including holding companies like Spectrum and other big cable companies accountable for when they fail to live up to their legal obligations. We need stronger oversight of taxpayer dollars to make sure that internet companies are providing the speeds required when they take government subsidies. And we need more market competition, and we need to encourage smaller internet companies to be able to compete with some of these big cable monopolies like Spectrum. So there's a number of things that have to be done, and it's so urgent right now because what we've seen over the last few months through coronavirus is something that we've known for a long time here in upstate New York. In order to conduct your activities of daily living, you got to have access to high-speed internet. In order to do work from home, which many people had to do during coronavirus, you got to have access to high-speed internet. If you're trying to conduct distance learning and you're a child or a parent who lives in a more rural area that does not have access to high-speed internet, it's very challenging, and school districts are struggling with that. If you're a business owner just trying to compete on a global scale, you have to have access to high-speed internet and adequate cell phone coverage. So we're outlining a number of things that need to happen. I'm part of a rural broadband task force, and there's a number of areas and legislation that we're supporting right now to try and bring better access to areas across the country that are underserved right now. The House did just pass, which I supported, something known as the Invest in America Act, which was our infrastructure package that passed back in July. It would provide much more funding for rural broadband, but also it included 2 amendments of mine to help create better oversight of cable monopolies and to ensure that customers are getting the speeds that they actually pay for, as well as language that I inserted in the Department of Justice funding bill that was recently passed in the House to hold some of these big companies accountable for their business practices. So a lot more has to be done regarding your specific issue. We can have Mr. Phelps follow up with you again to see what the latest is with your case. But certainly this is a concern. This is one of my top concerns and something I'm fighting to try and bring more investment and more oversight to our district to make sure that everyone has access to high-speed internet.
All right, thank you. Let's take another question. We've got Ryan from Canastota. Ryan, can you hear us?
Yes, I'm here.
All right, you've got a question?
Yes, I have a question for Mr. Brindisi. In regard this CARE Act, the new act that's coming out, the essential workers essentially got screwed over, to be blunt. The people that collected unemployment and sat home got an extra $600. Even if they collected $200, they got $800 a week to do whatever they need to. The people that are working 40, 50, 60 hours on the front line, making $40,000 a year, we only bring home $769 a week before taxes, minus our health insurance, minus our taxes. So the essential worker who's in a hospital or support services for the school or in a grocery store are making $600 to $800 less a month than the people that are sitting home. My question to you is, what is being done for the essential worker to help that disparaging difference between those?
Ryan, thank you very much for the question. You're 100% right. There are so many folks across our country and across our district who really could not stay home, who had to go to work, whether it was in the grocery store, whether it was a first responder, whether it was a healthcare worker, transportation worker, you name it, postal worker. There were so many folks that really stepped up and kept our economy moving, and also helped fight back against the public health crisis that was happening and continues to happen. We need to acknowledge the work that they did. That's one of the big reasons why I supported the HEROES Act, which passed the House back in May, which would provide hazard pay for essential workers who were on the front lines going through this and continue to go through it. It's unfortunate that our friends in the Senate don't seem to have the same sense of appreciation for those essential workers who really helped us during that crisis. And we need to make sure that those folks are acknowledged and are taken care of. And that's something I'm pushing for in a future stimulus package. So I appreciate the work you did. It doesn't go unnoticed. But I think the best thing we can do is to step up and hopefully provide some hazard pay for the folks who are out there fighting this virus and doing their best to keep us safe and the economy moving.
Thank you so much. All right.
I can also talk about, I know he brought up, Ryan did talk about the unemployment extension as well. So I do want to address that as well. As many of you know, in the CARES Act, which was passed and signed into law, there was an additional $600 federal pandemic unemployment assistance that was put into effect, which has since expired as of this past weekend because we have not been able to pass a new stimulus measure. I will say that the pandemic has created a unique, difficult and unprecedented situation, and normally the goal of unemployment compensation benefits is to provide earned benefits to tide workers over while they search for new jobs, and unemployment compensation does not replace all of a worker's lost wages traditionally, which further strengthens Americans' natural desire to work and earn wages to support themselves and their families. In this case, public health officials tell us that the best thing most Americans can do is stay home. So in this case, we did not want inadequate wage replacement, which is why you saw the additional $600 of additional unemployment. As I mentioned, this is something that ended this past weekend. I would very much like to see a compromise here moving forward. My hope is that a worker who has the ability to go back to work and take a paycheck will do so over a temporary increase in unemployment. But we also have to recognize that many people are still unemployed and cannot go back to work simply because there may not be a job there for them anymore, or perhaps they just don't have access to child care, or they are someone who has an immune deficiency and cannot go back to work because of fears of contracting the virus. So we need to come up with some kind of a hybrid approach here where folks who cannot go back to work yet still have some ability and some funding from the federal government to help care for their families. But for folks who can go back, who have a job available to them, they should be going back to work.
All right, thank you so much. Let's take another question. We've got one from Liz in Chittenango. Liz, can you hear us?
Yes, I can.
All right, you've got a question?
Yeah. First of all, actually, I just wanted to thank you all for these incredibly informative calls. There's so much information out there that's conflicting that it's helpful to get the clarification. So thank you for that. My question actually is two-part for Dr. Anderson. There's a lot of conflicting information that I've heard about the antibody test. I had a friend who was told at the lab when she had the test done that it would only test her for exposure to any coronavirus, not specifically to COVID-19. So I wanted to clarify that. or maybe the antibody test has changed since then. And if it does come out positive that you have been exposed to COVID-19, what have you seen as a percentage of reoccurrence of infection for those people who have tested positive for COVID but then have had the virus a second time?
Those are great questions, Liz. So antibody tests. I think we all have great hopes and wishes for what the antibody tests would be. And in an ideal world, which is not the world I'm about to, the reality I'm about to describe, but in an ideal world, we can imagine where it would be something like science fiction, where you could get tested, you test positive, and you get this immunity passport where you can go back to work, and your kids, if they're positive, can go back to school, and you wouldn't have to wear a mask or be really, live this new normal that we're all living. We still have a lot to learn about COVID-19 immunity and antibodies and what it means long-term, because we're only 4 months into this here in the United States. What I can say so far is a couple things. There's lots of different antibody tests that all perform differently. And some of this is a reflection of a really good thing. There's been a race to develop new tests and to make them available as quickly as possible. But I think there's hundreds at last count of different types of antibody tests, and some of them are good and some of them are not so good. Even with a very good test, we can't be sure that a positive test, it may reflect that you were exposed to a different coronavirus in the past, but actually we think that the tests are somewhat, we call it specific, meaning that if you test positive with most of the tests that are in wide use, we think it's more likely that you had COVID-19. But what we don't know, and that gets to the second $1 million question of the evening with COVID, is what does that mean for you long term? So we don't know that if you have antibodies that you're going to be protected if you get exposed again. And for most viruses, if you have immunity, it gives you some protection. Even for the flu, it gives you at least temporary protection. What we don't know is what happens 2 or 3 years from now. Will you be protected if you get exposed again and you had antibodies now? We honestly don't know. And that's something we honestly need to really understand better in terms of how vaccines may work. There's been a lot in the media with understandable concern about how many people are testing negative for COVID. So people who tested positive by PCR, so they found the virus, and then they test them for the antibody and they're negative. And there's these headlines of, dire news that antibody is waning quickly for COVID-19. We don't yet know what that means either. And that's really common to see with viruses as well, that if you get exposed to something, your body responds as it should, and then it drops pretty quickly because your immune system or your response to that virus changes. And so we're still learning what are the right things to look for, what are the right things to measure. And then the key question, boiling down your two questions to one, is we just need to understand what is a sign that you're protected against COVID-19 and how do we look for it? And we don't know that yet.
Thank you so much. I'm just going to echo. It is very informative, every one of these answers. All right, let's take another caller. We've got Donna. Donna, can you hear us?
Yes, I can.
All right, you've got a question?
I do, and my mother is nearly 95 years old, lives in a nursing home. I have visited her here at the hospital this past week because she fell and broke her hip. Everybody says they're protecting the elderly are vulnerable, blah, blah, blah. I get that. However, between 1 and 5, I could visit my mother, hold her hand, hug her, feed her, call the nurse, between 1 and 5. The rest of the time, she's totally alone. I get people are trying to help her, but they've got 30 other people that they've got to help as well. I visit my mother frequently. She has no say. She has no rights. I don't want to visit my mother through a screen. I don't want to visit her 6 feet apart. She can't hear. She can barely see. This virus, as we've all heard, is not going away anytime soon. Employees are in and out, 3 shifts a day. I know one who got on a plane, flew to Texas, visited her daughter, came back July 1st. She was at work on July 2nd. I have been isolating myself for 6 months nearly, just to be able to visit my mother. Every time there's a positive test or a case or whatever, it sets the whole home back every 28 days. I don't even really have the words to ask or say what I really need to say. And all I ever get when I ask a question is, there's a pandemic, the rules are different, you got to play by the rules. I want to know why I can't visit my mother without telling me she's vulnerable and there's a pandemic, and tell me something I don't already know.
I can try to take that one.
Go ahead. Go ahead, Donna.
Yeah, thank you. So Donna, I can hear your frustration and I appreciate it. I work in the COVID wards at Upstate, and I have seen the same scenario that you're describing, where there are older individuals or individuals from group homes, vulnerable individuals who do not benefit from social isolation and are alone and in these very lonely, sad situations. I can empathize because I've seen it. I'm not in your shoes, but I've seen it. I can say that the reason that we do it, so one is, of course, to protect the elderly, because we know that they're at increased risk of COVID. You know that. The other reason that we do it is to prevent spread to healthcare workers, to be honest with you, because we know that an individual coming from a nursing home, unfortunately, in this country and in this state, has a higher chance of having COVID than someone who came from their house. And that's because of the unfortunate outbreaks that we've had at nursing homes across the country. So it's protection both ways, with the concern that you wouldn't want to see a patient, have a healthcare worker become infected, and then they go on and see other people and infect them. So that's the hard rationale for why they do it, but I completely understand and hear the pain and have witnessed it about how difficult that is in practice. And I think that's where this virus, we hear that tone throughout the whole call about how this virus has affected every aspect of our lives. But that's, to me, one of the most painful aspects of it, is that it's really impacting the quality of life for some people who are elderly and could really use the companionship. So I hear you, and I wish that it were otherwise. Yeah.
Yeah, I'll just echo that, Doctor. And Donna, I share your frustration too, and certainly my best to your mother. I hope for her to have a speedy recovery. And I think that one of the things we have to address, certainly at a federal level, is helping to provide some more funding to our nursing homes to help better contain the spread of this virus. One of the key pieces that was in the HEROES Act, which was passed back in May in the House, was funding for what's known as strike teams, to be able to help states assist nursing homes when there is a potential case. A strike team can go in there and help contain the virus before it starts to spread throughout the nursing home. And the other area where we provided some funding, and we'd like to see this as part of the next stimulus bill as well, is for things like virtual visitation, to help family members who cannot perhaps see a loved one in person, but still be able to give them the ability to see them virtually through a Zoom call or something along those lines. Again, it's never going to replace seeing a mom or dad or grandmother or grandfather or a loved one in person, but it's hopefully the next best thing that's available during this difficult time.
Thank you so much. I was thinking we had time for one more caller, but really, when I look at the time, we've just about run out. So, Anthony, do you want to offer some closing remarks?
Well, thanks, Sarah, and thank you to Dr. Anderson and Annabelle. You got let off tonight, so we'll certainly. I know we have some IRS questions, and I would encourage folks that if you didn't get a chance to ask your question, please feel free to stay on the line. There's an option to leave a message so we can have one of our caseworkers get back to you on whatever issue it is or question you might have. Always. Also feel free to call my office and reach out to us. Our phone number is area code 315-732-0713, 315-732-0713. Please call us if you part of our team is still working remotely. Part of our team is in person in the Utica and Binghamton office. So for some reason you get the answering machine, please leave a message, and we will get back to you and do our best to answer your question. We're getting a lot of questions, of course, about the stimulus packages, the electronic debit payments from IRS. We're getting a lot of questions on a whole host of issues surrounding coronavirus. Or if you just have an issue with any federal agency, VA, Social Security, Medicare, whatever it is, please feel free to contact our office. We're here to help. Again, thank you to our guest, and please, everyone, stay safe, and we'll talk to you soon.